And then the criminal, them right upon the taxi route.
Okay, good evening again, everyone. Thank you very much for waiting. Again, my name is Alicia Whittingham Gale, Staff Welfare Officer for the Western Regional Health Authority. We are going to begin. This evening, we have with us a presenter that is no stranger to us, coming to us again to present, this time on the topic gender-based violence. Now, we've been hearing quite a bit in the social media sphere in recent times about gender-based violence. What is that? And also, we've been hearing so many things happening on the news as it relates to violence against a particular group. So we decided to ask Woman Constable Woolery, Shenique Woolery, from the Safety and Community Branch of the JCF. She's here with us this evening again. Welcome, Ms. Woolery. Thank you very much for agreeing to speak with us this evening again. And without further ado, if you're ready, I will hand the reins over to you.
All right, good evening. Thank you so much for having me once again on your platform to just share with your members on issues and touchy topics today that's happening in our current world. Gender-based violence is something that is widespread and has been an issue for quite a bit of time. And most persons, they really don't understand what it is all about. And sometimes victims really don't know that, look, they have avenues that they can reach out to get help whenever they are experiencing situations of violence against them. And so this presentation is just to go through and give a better understanding of what gender-based violence entails and how we can, as a society, work together to help victims affected by this social problem that we're having. Just trying here to, okay, there you go. Okay, good. All right, so we're continuing from where we left off. We're on to the definition of gender-based violence, and we were saying a simple definition of same would be that it is an umbrella term that is used to describe any harmful act that is perpetrated against a person's will and is based on socially ascribed that is gender differences. So we're talking about males and females, and it includes acts that inflict physical, sexual, mental harm or suffering, threats of such actions, coercions, and other deprivations of liberty. We also have a definition from the United Nations Declaration on the Elimination of Violence Against Women. And from Article 1, it states that gender-based violence is any act of violence that likely results in physical, sexual, psychological harm or suffering to women, including threats of violence, coercion, or arbitrary deprivation of liberty, whether occurring in public or in private life. So gender-based violence, it can be perpetrated on domesticated instances as well as instances out there in society. So it doesn't have to be in the homes alone. It can be coming from your communities and a society at large. It can even be coming from the workplaces as well. And we'll see that further on in the presentation. Also, Article 2 of the same declaration, it stated violence against women include, but not limited to, as we said already, the acts of physical, sexual, and psychological violence in the family or in the community. And the specified acts of violence to include battering of individuals, sexual abuse of female, rape, including marital rape, sexual harassment and intimidation, trafficking of women, forced prostitution, among others. As the term suggests, gender-based violence, one party basically is the victim of a particular violence, whether it be the physical violence, the sexual, psychological violence. And the world we live in today, we categorize gender-based violence in a sense that we declare the victims are normally females, right? And so we normally would create laws and policies to protect especially women in household and also in the workspaces and in society at large. So we have some myths about gender-based violence, and I'll just run through them quickly. These are some things or thoughts that people have when it comes down to gender-based violence that are not necessarily true, right? And so when people normally generate these thoughts, what happens is that they really don't know how or where to get help. They really necessarily don't have the proper information or education on the topic. And so if they happen to become victims of gender-based violence or domestic violence, violence against women, because they all fall in the same category. And so if they happen to become victims of this, then they won't even know that they are and may not try to get help for themselves. And so a myth I'm seeing on screen here is conflict and discord. So it says conflict and discord are normally part of any relationship. Yes, in relationships, you may have two tongues meet and stuff like that. But we're not saying that the conflict should escalate in such a manner that the one party will become victim of abuse necessarily. And so that's a myth about gender-based violence. Another myth is domestic violence happens to certain type of persons. It doesn't matter your socioeconomic status, your class, whoever you are in society. I mean, we all experience domestic violence. It's right across the board. It's something that has been happening quite some time, and it's been a global problem all over. So it doesn't really matter who you are as a person. It is a likely possibility that at some point you may encounter domestic violence. All right. Gender-based violence only includes physical abuse, which is hitting, punching, biting, and slapping. Persons may also think that if he's not beating me and harming me physically, then I am not experiencing any kind of violence then, and that's also a myth. Gender-based violence caused by substance abuse, such as alcohol and or drugs. It is a contributory factor to how anger progresses and is passed on to the other party, but it's not necessarily a cause for the violence that is perpetrated against another person. Women should tolerate violence and keep family together. No, this is a pretty funny one. If you are being a victim of violence within your household, then you might have some persons who want to say to you, look, if you perhaps report this case of violence, especially if you are a married couple, if you perhaps report this case of violence and abuse happening to you, then it might result in some form of shame, and they want to keep up, especially if they're persons of society and they want to keep their good name and good standard, then it might not be reported and persons might coerce them not to report it. Other myths are domestic violence is a private family matter in which the state has no right to intervene. That is a big myth. So even though it's happening in your personal space, your household, husband and wife, girlfriend and boyfriend, common law relationship, you might think that the state has no right to intervene, especially the perpetrator might think that the state has no right to intervene. Then he is wrong, because the state had created laws that protects people against violence. For example, we have the Offenses Against the Person Act. And when crimes are being committed, that's when the police get the authority to act on these circumstances. So we have the power, we get the power basically by way of Offenses Against the Persons Act. Another is sex worker cannot experience rape. That is also a myth. Persons might think that, look, this is funny, but if you're a sex worker and someone comes to, you know, purchase your service, and at the end of the service, they actually does not want to pay, then it constitutes a rape, because even though it was consensual in the beginning, there was a verbal contract between both that at the end of the service, then you would, you know, get some form of compensation. If that compensation was not given, then it's called a rape, because you actually took the sex by fraud and trick. So that's another myth about gender-based violence. And this might be new to some persons, because they would be saying a sex worker cannot be raped, but it is true. A man cannot rape his wife. This is also another myth, because if you're living together, even though married, and are separated but are staying at the same place, and your husband forcefully have sexual intercourse with you, then this is also an offense, and it is called rape. A rape can also be committed maritally if your husband knowingly have sexual intercourse with you, knowing that he has a sexual transmitted disease. And so that also can constitute marital rape. Another is most gender-based violence is perpetrated by strangers. That's not true. Victims of gender-based violence are helpless, and survivors of sexual assault are responsible for their attack. It doesn't matter. Persons might say, look, this person always dresses scandalously when they're on the road and stuff like that. But at the end of the day, everyone has the right to wear whatever they want to wear whenever they want to wear it. And it doesn't really matter how a predator might see that person. It gives him no right to take advantage and to commit a sexual assault against that person. So survivors of sexual assault are not responsible for their attack. All right, I'm seeing that the presentation is now showing on screen. All right, so stories. We have about 2 stories listed for victims of gender-based violence. These persons really had no idea. Some of them had no idea they were being victims of gender-based violence until the United Nations, who they went there in their country and have dialogue with them, trying to help them, basically giving them a bit of education as it relates to gender-based violence. And so through conversation and dialogue, they became aware that, look, I am a victim of gender-based violence. These kind of acts normally happen in the Middle East, down in Africa, where men seems to always want to gain control over the women in those areas. Luckily, Jamaica has been moving forward and has been, you know, using laws and policies to protect women, especially against cases of violence. So for this story you're seeing on screen, one of the victims, they stated that my husband slaps me he has sex with me against my will and I have to conform. And before being interviewed, I thought this was normal. So before the persons from UN actually went in and started talking to this woman based on the culture in Bangladesh and how they treat women, she actually thought that, look, it was normal for my husband to be physically abusing me, sexually abusing me, and all of these was basically against her will. So that's also a story from Bangladesh. We have a second story also from Bangladesh. It says that, so I take a blanket and I spend the night with my children out in the cold because he is hitting me too much. I have to take the kids to stop him from hitting them too. I would go out in the field and sleep there all night. I have done this more than 10 times. So what you're seeing here is a woman who has been physically abused by her husband. The abuse doesn't only stop at her, it went on to even the children. And so what we're seeing here is that gender-based violence is not only violence against women, but children who are part of the households are basically victims of this violence, and it can lead to issues later on, whether in their relationships and how they treat their partners and their overall psychosocial well-being. And so persons basically around the world does not really have much of an understanding based on the culture within their country about the violence being perpetrated against women as well as their rights just by being women. So we have some forms of gender-based violence that we have. I've been speaking of some throughout the presentation so far. And so the first one to touch on is physical violence. And physical violence is the intentional use of physical force with the potential to cause death, disability, injury, or harm. And so we have some examples of physical violence that are perpetrated against women. And we think these are choking, slapping, use of weapons such as firearms or even knives, or even coercing other people to commit the offense of physical assault on the victim. So you don't have to basically commit the offense by yourself, but you can, dictate to someone that, look, this is what I want you to do, and you are to do it, and that person commit the act of violence against the individual. We also have sexual violence, which is the use of force to compel a person to engage in a sexual act. An attempted or completed sexual act involving a person who is unable to understand the nature of the act. You have some persons who are challenged mentally and they really don't understand what it is that you're doing to them. And so, accused or perpetrators might use that to find an easy way to abuse sexually victims, especially females. And it still constitutes an offense, even though that person really doesn't understand and cannot express themselves properly. But if they are given legal representation to assist them in sorting the matter, then this can be something that can be acted upon and perpetrators can be held accountable for. Also, abusive sexual contact, including intentional touching through the clothing. We also have another form, psychological or emotional violence, and this is causes trauma to victims by acts of threats. So there might be a perpetrator who might, decide to carry out assaults on a female then. And he may not have gone to the extent where he physically completed the action, but he uses threat based on his status quo. He might be a known offender. He might also be someone that is feared much in the community, and based on his status quo, he might want to incite threats to a particular individual to basically commit acts of violence against them, whether physical or sexual. And some examples of these psychological or emotional violence might include humiliation, control over what person can do, deliberately doing something to make the other person feel diminished, and isolating persons from friends and family. We have seen this one. Well, I have seen cases of this one during my tenure in the JCF where persons have become victims of gender-based violence, especially women, and the husbands basically does not want them to communicate much with their relatives and friends because he or she knows that that person will perhaps get some form of coaching and counseling from the relatives and friends and might be able in the long run leave the relationship, which he doesn't want. So I said before, we have just a short list of some of the types of gender-based violence. We have intimate partner violence. And as we stated before, it can be physical, sexual, psychological, or economical. Childhood or sexual abuse, rape, which includes marital rape, as we spoke of before. We have human trafficking, trafficking of persons acts in Jamaica, basically provides a little bit of support for victims of human trafficking. We have acid throwing, we have female genital mutilation, and that's basically cutting off the female genitalia. And this normally happens in Africa, Asia, and the Middle East. Luckily, we don't have that happening in Jamaica. We also have female infanticide. Again, for some of these areas, we have persons who, when females get pregnant and it's not a boy, sometimes because they are so gender-based in that area, they'd like to, have the females commit abortions so that, we don't have any more females coming along. All right, so we have violence against women, and this is also a form of gender-based violence, and it is a much more popular form of gender-based violence. And it says that violence against women and girls, it is quite widespread, it is persistent and devastating to human rights violation today. It has been a sore point so far, and I don't know, but that's the specific times of the years we have, especially in Jamaica, we have some circumstances where we're experiencing high levels of violence against women. Women are being found, women are going missing, they turn up dead and stuff like that. So it has been a really, really widespread issue and something that citizens need to be educated about so that we can move forward in dealing with this situation. Also, violence against women. All right, violence against women, particularly in intimate partner violence and sexual violence, and that's a major public health problem, and it's a violation of women's human rights. Continuing with gender-based violence in the form of violence against women, it says that intimate partner violence, I think we have two types, intimate partner violence and sexual violence. We're saying intimate partner violence, it refers to the behavior by an intimate partner or ex-partner that causes physical, sexual, psychological harm, including physical aggression, sexual coercion, psychological abuse, and controlling behaviors. So this can be not only be perpetrated by existing partners, but also by ex-partners as well. So some of the factors that we have identified specifically associating with intimate partner violence are past history of exposure to violence. We have marital discord and dissatisfaction within the household. There has been some difficulties communicating between the partners and male controlling behaviors towards their partners. The other form of violence against women, sexual violence, any sexual act, attempt to obtain a sexual act or other act directed against a person sexually using coercion by any person, regardless of the relationship to the victim in any setting. So you basically commit an act against the person, a sexual act against the person that is in violation of their human rights, whether you want to physically commit the act or you coerce the person into having them become a victim of the act, then it is an offense against the law. And some factors that we have, you can skip the slide. Some factors associated with sexual violence perpetrators, beliefs in family honor and sexual purity. And when we talk about sexual purity, we're speaking to same-sex intercourse. So they're not interested in any form of same-sex intercourse, basically. So they might want to perpetrate violence against that person. It's normally perpetrated by persons in society at large, especially societies where they are homophobic and don't believe that same-sex partners really have rights, basically. Ideologies of male sexual entitlement and weak legal sanctions for sexual violence. I think that in Jamaica, we have basically come a far way, and we basically have put in certain laws to protect victims from sexual violence and acts of sexual violence thereof. So gender-based violence definitely also has impact on children. If you imagine living in a family where children constantly witness their parents being abused, especially the females. And so what happens is they tend to think that, look, this is a normal way of life. And so when they grow up, whether it be males, they perhaps want to, display this kind of violent behavior in their family, assaulting their partners and stuff like that, because growing up, that is what they are used to, and they believe that this is the new norm. But on the other hand, females growing up in household where gender-based violence is prevalent might think that, look, if the man continues to beat me, or if he's not ill-treating me, mistreating me, then he doesn't really love me, because this is what I grew up to see daddy doing to my mommy, and it only makes sense. So if it's not happening to me, then basically what am I living for? So this can also be associated with perpetrating or experiencing violence later on in their life as well. It might also impact them psychologically as well as emotionally. You have some students who are living in household where there is quite a bit of violence, when they tend to not perform well in school, and they basically display deviant behaviors while at school, not paying attention in classes, because these are some of the things that are on their minds. When I go back home, this is what I'll be seeing my mommy and daddy doing. They might, have attacks and basically burst out into violence within schools. They may start to fight a lot and just become deviant overall. Nobody can basically speak to them. Let's move along. We have some factors listed that perpetrate violence, and locally in Jamaica, we really are not experiencing this so much. Sociocultural factors, which speaks to unequal power relations and low status of children in society. Also, legal factors, which includes inadequate legal provisions, accessibility of legal services, and ignorance of rights and responsibilities. I think that the laws in Jamaica has adequately provided basis upon which victims can be protected and perpetrators can be placed before the law, before a court, so as to, you know, help to minimize the occurrences of violence within the space. We also have policies and practices, gender insensitive policies, for example, absence of sexual harassment policies and other policies in the work environment. And I think as a nation, we've been doing well based on some of the workplaces that I've been to. Most of them, they would have, you know, outline their harassment policies and stuff like that to ensure that members are compliant. And so just to create basically a safer workspace for every individual. You can skip along. We have economic factors, which includes dependence, poverty, limited opportunities, and income sources. Sometimes we find that persons who are victims of gender-based violence, they necessarily are persons who are of lower socioeconomic standards, those who are struggling to basically live, pay bills, and to take care of themselves. And so what happens is that they become dependent on the abusers, and you find that the cycle continues based on this need that they have. We also have the education factor, illiteracy, and limited educational opportunities. You know, in some countries, you have cases where females aren't basically supposed to go to school. So even if they go to school, they aren't allowed to go to classes with boys, and so they are separated. I think that's in Afghanistan. And they don't really get much of an education, basically. So they don't really have the empowerment to understand that, look, this is how I as a female should be living in society, and they have an understanding basically of offenses that are being committed against them, and know that, look, they have a right, and the system is there to stand up and back them as it relates to that. We have institutional factors, which includes the lack of adequate victim support services, the police service that may not provide an enabling atmosphere. You might go to the police station, and because it's so small, you know, the reports are being taken in view of a lot of persons, and you might be ashamed of the atmosphere. You don't want everybody to be listening to your business and stuff like that. And so you may not feel the need or the urge to go to the police station to make the report based on factors such as these. We have some health consequences as a result of gender-based violence. And we say that it results in fatal outcomes like homicide and suicide. So if you're being beaten left, right, and center, it is a possibility that at one point in time that you might, you know, lose your life based on also the emotional and psychological effect that it may have on the victim. They may want or tend to commit suicide. It leads to injuries, with the majority of women who experience intimate partner violence reporting an injury as a consequence of the violence. So we have persons coming in and they're reporting cases of unlawful wounding, they're reporting cases of grievous sexual assault, they're reporting cases of assault, OB harm, etc. So it leads to unintended pregnancies and induced abortion. For example, sexual violence committed against women. The perpetrators may not use condoms, I find that victims may get pregnant, and the fact that this is not something that they wanted in the first place. You know, we have a lot of them who may want to select the option of abortion. It may also lead to sexual transmitted diseases, given the fact that they really did not use condoms. It also leads to depression, post-traumatic stress disorder, and other anxiety and sleep disorders. It also increases the use of drugs, which includes alcohol and other harmful substances. We spoke about the consequences of children before, so I think we can just go ahead and skip that slide. Here we have the role the health sector can play in gender-based violence. Like every organization, we all have a role with regards to what's happening within our society, and gender-based violence is not unique to us. And I think that everyone can play their part to reduce the effect that it has on victims. And so the first role is to advocate to make violence against women unacceptable and for such violence to be addressed as a public health problem. Also to provide comprehensive service, which is to sensitize and train healthcare providers in responding to the needs of survivors holistically and empathetically. Also to prevent the reoccurrence of violence through early identification of women and children who are experiencing violence and providing appropriate referrals and support. So sometimes they have victims coming to the hospitals or health centers with signs of violence and abuse. You might just want to, have a conversation with them, not necessarily jump in to try and get into their business, but to not encourage them. You might eventually find out what exactly is happening to them. And so you may want to sympathize with them. However educated you are as it relates to the situation and the laws governing the act of violence against women, you can perhaps, encourage them and enlighten them of the ways in which the situation can be dealt with. And also you can, based on the number of cases that you have coming in within your institution, you may want to, on some clinic days, conduct some form of, session with your patients, and you just advise them, encourage them, and educate them about gender-based violence and how they, as a victim, can overcome and rise above. Can skip along. So we have some laws that protect women, especially against gender-based violence. Males are being protected as well. We have the Sexual Offences Act. We also have the Offences Against the Persons Act, which deals with assaults and violence committed against a person. We also have Domestic Violence Act and the Child Care and Protection Act as well, because children are victims also of domestic violence. Some institutions that we have available for victims, we have the court, where matters are, taken before the court for, the judge to pass a verdict and, help the victim, regain that which was lost. Also, Victim Services Department, I think this is a government service and it's located at Overton Plaza. They provide counseling sessions for victims of abuse and other services. They provide assistance in many areas, and this is also free of cost. So referrals can be made to the Victim Service Department on behalf of victims who are victims of gender-based and domestic violence. We have the restorative justice, and the restorative justice is basically a government entity also, and their responsibility is to, kind of help with the clearing and the backlog of cases that's going through the court system. What they do is to have mediation session and to help to recover harm or loss to one party that was affected. We also have the health department and the police force. Once a case of domestic violence is reported, we know basically have a system where we have to collect all the necessary details from every station on a daily basis, and we pass that on to the domestic violence center. And the personnel at the domestic violence center, they're the ones who would basically do some follow-up. They will do some intervention and referrals where necessary. And I think that's the end of the presentation. Now we are open for questions.
Thank you very much, Woman Constable Woolery. Thank you very much. You would have given us great insight in your presentation on how we can definitely identify when this type of abuse is happening. We open the floor. Any questions from our audience to Constable Woolery? Any questions or comments that you would like to make at this time?
Good evening.
Yes, good evening.
Thank you so very much for your presentation, Constable. My first question really has to do, when we talk about gender-based violence, we tend not to even mention the males. To what extent and what's your experience with gender-based violence affecting males?
Right, so that's a very good question. And during my research of the topic, I was basically looking for cases where men are being victims of violence. There are cases, however, statistics shows that majority of the time women are the victims of domestic violence and gender-based violence per se. Throughout my tenure in the JCF and dealing with cases of violence against individuals, whether it be males or females, I have never encountered a case where a male was being abused by their partner, but I have heard of it. I have even saw on television or social media, that is, in Jamaica. I think it was also in the Western region where a man was being beaten by a woman. And so, as I said before, there is a law to protect these individuals, not only females, though the law has been coined in a way that speaks to females to an extent. There are still acts in place that protects males as well. For example, we have the Offenses Against the Person Act. We also have, under the Sexual Offences Act, we have buggery laws and stuff like that. And that definitely has to do with males, because a female cannot be buggered. So even if a female was raped and it is in the anal, then it is still considered as rape. So under the Sexual Offences Act, then buggery is what is used to protect males. And overall, Offenses Against the Person Act, which deals with any offense that is being committed against an individual, doesn't matter their gender. It can be dealt with and brought before the court.
Thank you. So as a follow-up question though, do you think that males who are being abused are being silent? They're not coming forward because
they're
there's
ashamed. I believe
embarrassment?
so. I believe males are ashamed, and I think that it's based on the culture and the society that we grew up in, because in earlier stages of development, I think that males were always told to try and be strong. They were always told not to cry and man up, and so recognize that later on all of this come to affect them, because they really don't know how to put their emotions out there and deal with situations affecting them. They don't want to be seen as a soft, and society normally label them. soft and perhaps gal boy and stuff like that. They're not man enough. And so because of these reasons, they tend to shy away from reporting case of violence against them. And I guess it's based on this reason that we basically don't have a lot of statistics showing males being victims of crimes. Gender-based crimes, that is.
Okay, Dr. Graham, may I go ahead?
Yes, thank you. Good evening, and thanks for that presentation. You had mentioned that some victims of violence are what I usually term economic hostage. And I'm just wondering what sort of infrastructure, how are we doing in terms of having a safe space for these persons who need to live for their welfare, for their children's welfare? How developed is the infrastructure in terms of having a safe haven, a sanctuary, a place of refuge for women who would have been victim of sexual assault, but they don't have the social support to go to a family member or to survive on their own with the kids, with the children?
And that's a very good question. And if I can remember correctly, I think Minister Babsy Grange came out the other day and they basically opened a shelter for women who are victims of abuse and domestic violence. And so the shelter will, take care of them for certain aspects and for certain tenure of their lives until they, are rehabilitated and can, basically go back into communities to live a normal life. I think though that it is not really popular amongst the nation since it was recently launched, but I think it's there to assist. And so when cases are routed through the police force and eventually based on the setting up of domestic violence centers, then recommendations can be made thereof.
Okay, so the police would link the women that are in need of same police facilities, what you're saying?
Definitely, they can be a link to the facility through the domestic violence center that is implemented recently based on a number of cases and the increase in violence that we have going on now.
Unfortunately, we might need more of them and maybe more scattered.
I think so too. And I know for the western area, the JCF is currently working on a domestic violence center where matters can be immediately reported to them for attention. So that's currently in the pipeline.
Okay, thank you.
You're welcome.
I have a question, Constable Woolery.
Yes, go ahead.
During the presentation, you mentioned several times that gender-based violence is not always a physical form of violence. There are other types of violence. However, I'm wondering, are there laws that are out there in Jamaica that are instituted to protect I wanted to say women, but whichever person from these other forms of abuse.
Violence.
So especially, for example, in a marital situation where the husband is emotionally abusing the partner, are there laws out there that can help to prevent or to curb these other sort of abuse?
All right, so I really don't want to be quoted on this one, but I know especially for cases where you have abuse, especially emotional abuse, it normally stems from physical abuse and sexual abuse, and the latter part of it is the emotional abuse to the victims involved. And so when these cases are reported, in truth and in fact, there's so much that the police can do when a case is being reported. For example, emotional violence, then I don't think that an offense per se was committed against a person. So it has to do with your inner well-being, your psychological space. And I don't think that there's not really much that we can do in terms of arresting someone for emotionally abusing another, especially in marriage. And so when we have cases that comes to us, we tend to refer them for support services from victim services where they have trained counselors to basically, conduct mediation sessions and bring them through whatever they have been experiencing at home. And if it is that these matters cannot be resolved, then, they might proceed to the family court and seek audience with a judge who may make further rulings as to, what's happening within the household. And, that can lead to a split if that's what the family basically wants, or if that's what's best for them at the moment.
Okay. Okay. Any further questions from the audience? Mr. Campbell?
Yes. When I think of some of the root causes of gender-based violence, a lot of it is cultural, how we
Right.
are socialized, how we train our boys, how
Right.
to relate to women, etc., etc.
Right.
Do we have any programs in place that, because we're talking about prevention here and starting school, do we have any programs in place to address this, especially in schools
Well, that's
or for
something.
our young men?
Right. Well, that's something that we probably can work on. I'm not sure of how the programs are, but what I know is that in the JCF we have school resource officers that are responsible for schools across the divisions. And when we go in, we try to seek to mentor, because what we do is that we work closely with guidance counselors at these schools, principals, etc. And when situations are brought to us, because that the children would normally share information with their guidance counselors. And so when we visit these schools, we tend to want to speak with these people first. And so through our conversations with them, we would normally hear about situations of violence happening in households and stuff like that. And what we'll normally do is to try and be a mentor for that child, reach out to the parents as much as possible and to educate them on how this is basically affecting the child and definitely his or her performance in school. And also within communities, I know we have social groups going around, such as the Peace Management Initiative, etc., who always try to go into communities and to educate youths about certain social disorder that's happening in their communities and how they can rise above all these social disorders, and to just basically get them into programs for upliftment and to help them become better members and productive members of society. So I'm definitely not sure about a structured program that is out there working to, alleviate the issue in schools and in communities, but I know through certain institutions that I've mentioned before, as well as the JCF, we have been, trying to get information where we can and to deal with the problems as we learn about them.
Okay, thank you for that. All right, it's now 13 minutes after 7 o'clock. Any last question before we close our program today? Okay. Okay, since there are none, I just want to say to Ms. Woolery, thank you very much for taking the time to speak to us this evening. And let me just publicly say that we know that this week is November 22nd to the 28th is Police Week. And
Yes.
we would just want to say happy, I'm not sure how you coin it, but happy Police Week. And thank you we do recognize, you know, the hard work that the JCF and other police
Yeah.
divisions are putting into community services and keeping us safe. And this session is one such way that you guys take the time out to police. So we thank you very much. Thank you very much for coming in and speaking to us. This presentation was an excellent one, and it really opened our eyes to the various different types of gender-based abuse, how to recognize them, and the institutions that are available for persons to get help. So we thank you very much for that. Thank you everyone for joining. We really appreciate you coming on. And before we close out, I also want to say that at 8 o'clock